Welcome to our video about self-care tips for type 1 diabetes. If you have type 1 diabetes, you're likely familiar with the mental health problems that often accompany this disease. In addition to the symptoms, you may also experience cognitive decrements and depression. In this article, we'll look at some self-care methods for dealing with these problems. If you're not sure how to start, read on. Below, you'll find 4 tips to help you manage your mental health in a way that keeps you as healthy as possible. Depression. While many people with diabetes do not discuss their mental health concerns, talking to a doctor or other healthcare provider about depression can be a powerful step toward recovery. Early treatment can lead to improved medical outcomes. Depression and diabetes are often associated with increased healthcare costs, decreased quality of life, and more missed workdays. Depression in adolescents and adults can result in higher HbA1cs, more frequent DKAs, and difficulties transitioning to adult care. Identifying depression and seeking help can help patients improve their overall health and their quality of life. In fact, adolescents with type 1 diabetes have a doubled risk of suicide. Suicides and accidents are the leading causes of death in this population. According to Dr. Maurizio Pompili, director of the Suicide Prevention Center at the Sapienza University of Rome, patients with type 1 diabetes are more than double the risk of suffering from depression than others. Because of this, it is important to evaluate the mental health of kids with diabetes and offer them appropriate care. The prevalence of depression among type 1 diabetic patients has been reported in several studies. A systematic electronic search for relevant studies was conducted to identify the risk factors for depression among adults with type 1 DM. Findings from this study revealed that depression was common among these patients, ranging from 10% to 54%. Furthermore, the inclusion of a control group of non-diabetics in the study population helped to further refine the search. Anxiety. A recent study found that having a parent with type 1 diabetes was associated with greater anxiety among mothers than in fathers. The researchers also looked at HLA and autoantibody status. They looked at perceived risk, parental education, and working status, as well as perceived diabetes risks. Among the factors that influenced anxiety, the researchers found that gender, education, and employment status were significantly associated with higher risk. Further, parents who had a previous history of type 1 diabetes were more likely to report higher levels of anxiety, regardless of the severity or frequency of the disease. Although pharmaceutical drugs are available to alleviate anxiety, Heyman stresses that they will not be enough on their own to cure diabetes anxiety. Instead, people must learn to think about their diabetes in a more confident and logical manner. A balanced perspective on diabetes will help reduce anxiety and prevent it. By gaining a balanced perspective, patients can better manage their diabetes and live a happy, fulfilled life. Here are some tips on how to manage type 1 diabetes anxiety. The American Diabetes Association recommends that adolescents with type 1 diabetes undergo screening for depression once a year. Anxiety tests are particularly helpful for adolescents because they can identify potential mental health problems. Moreover, depression and eating disorders are common among these patients. Consequently, parents should be aware of their children's health risks to help them manage their disease and improve their quality of life. They should also discuss the risks of developing depression with their children if the child has diabetes. Cognitive decrements. While cognitive decrements in type 1 diabetes are subtle, they are larger and affect some domains more than others. In fact, one recent systematic review estimated a reduction of SD of 1/3 to 3/4 in people with type 1 diabetes. Among these domains, mental flexibility, general intelligence, and psychomotor speed showed the largest decrements. The effects of type 1 diabetes on cognitive performance were smaller, however, in adults and children. The earlier the onset of diabetes and its duration, the greater the cognitive decrement. However, older age was not related to cognitive impairment. Researchers should focus on cognitive decrements in people with type 1 diabetes, and also examine the psychological status of these patients. It is important to note that these cognitive changes may not be apparent for a few years. The study also compared people with diabetes with individuals who were age-matched to participants who did not have diabetes. The researchers believe that this means that cognitive decrements in people with diabetes are gradual and occur over longer periods. Researchers have found that the brain volume and structure of people with type 1 diabetes are reduced, and the distribution of different brain regions has changed. These changes have been associated with decreased cognitive performance and a decline in self-confidence. Fortunately, the disease does not affect all aspects of mental health. There are medications available to help. In addition to taking insulin and glucose pills, a person with diabetes can use neuroimaging to assess how their brain is affected by these conditions. Self-care. Self-care for type 1 diabetes can be challenging. Changing lifestyle habits and eating right can help manage diabetes, but many patients also experience mental health issues, and dietary changes can be challenging, too. Supportive care by healthcare providers can help patients change behavior and overcome mental health issues. It's important to make dietary changes to manage diabetes, but self-care is not the same as a diabetes diet. Using an online tool, healthcare professionals can help patients make dietary changes that will benefit their overall health and well-being. The loss of spontaneity is a common source of grief for newly diagnosed families. Carrying diabetes supplies everywhere can lead to feelings of vulnerability. Insulin, lancets, batteries, and ketone strips are just a few of the items you must carry around. The burden of all these items weighs you down and can make you feel vulnerable. Allow yourself some time to grieve the loss of spontaneity that you once experienced. Diabetics experience a significant daily burden, and this can be stressful. Managing diabetes is not easy and requires constant alertness. In addition to the physical burden, it also puts individuals with T1D at higher risk for mental health problems. In addition to the increased stress, type 1 diabetes can cause emotional distress and burnout. Fortunately, there are many ways to combat mental health issues, including pursuing medical care, seeking counseling, and engaging in community support. Yoga. One way to improve your mental health is to practice yoga. While many people practice yoga for physical health, it can be very beneficial for type 1 diabetes patients as well. It has proven to be effective for many people with diabetes, including improving their adherence to medication and self-care behaviors. Yoga also promotes a calmer and more positive attitude. It is also a great way to manage stress. However, it can be difficult to know how to incorporate yoga into your routine. Fortunately, yoga is one of the safest forms of exercise. Although there are different exercises for people with diabetes, yoga is a great way to help balance blood sugar levels and improve your mental health. Yoga will also improve your strength and flexibility, which are important for managing your diabetes. There are hundreds of different yoga poses for type 1 diabetes, so you are sure to find one that suits your needs. But, you may also want to choose a beginner's class and begin with just a few poses. As with all exercises, it is best to seek qualified instruction before beginning yoga exercises. Although many types of yoga are safe and enjoyable, some styles are strenuous. People with diabetes and cardiovascular disease should avoid fast-paced yoga. Beginners should avoid extreme practices, as this can cause dizziness or a drop in blood pressure. For this reason, you should always monitor your body's reaction to a new form of exercise and pay close attention to warning signals. Meditation. Meditation is a proven way to improve your mind and body. While most diabetes treatments are focused on physical pain management, meditation is beneficial for a variety of conditions. This is because people with advanced diabetes often experience severe pain and depression due to various complications. Meditation can also help to manage stress and improve your quality of life. It is a healthy and effective self-management method that may complement conventional medical treatments. To learn more about the benefits of meditation, continue reading. While many people have heard of the benefits of meditation for type 1 diabetes, it is not always clear why this practice is beneficial. Generally, it's believed to improve the immune system and help people cope with diabetes. Studies show that it helps people manage stress and improve sleeping habits. Other benefits of meditation include lowering blood pressure, improving sleep quality, and reducing eating disorders. Meditation can also limit stress-based eating and help people develop compassion and acceptance. One study examined the effects of meditation on people with type 1 diabetes by using biofeedback instruments. A biofeedback instrument provides visual feedback while you practice mindfulness meditation. The biofeedback instrument helped participants learn relaxation skills. The study revealed that meditating with the help of biofeedback decreased depression and stress scores. However, other research needs to be done to confirm these findings. But how can you tell if meditation is effective for your mental health? Communication. There are many ways to communicate with someone who has type 1 diabetes. You can meet in person or use technology. Regardless of how you communicate, you may need to be aware of the best ways to communicate with someone who has diabetes. Here are some ways to help you make these connections. Identify the person's emotional state and begin by asking open-ended questions. A supportive, empathic environment will allow you to build a connection and provide reassurance. If you suspect that a patient is having difficulty with their diabetes, it is crucial to contact your doctor immediately. They will help you create a treatment plan and recommend different medications for the type of diabetes you have. Your doctor can also diagnose any mental health problems and refer you to the appropriate physician if needed. In an emergency, call 911 or text TALK to 741,741 for immediate help. If you think your loved one may be having a mental health issue, remove any potentially harmful objects from the situation. If your loved one is struggling with T1D, there are many ways to support them and learn to cope with the challenges of this condition. A physician can help you improve your self-care through education and support. A spouse or partner can accompany you to doctor appointments, and other diabetes caregivers can reassure you that you are not alone. If you are experiencing depression or anxiety, it may be beneficial to see a psychologist or social worker. A doctor can help you learn healthy coping mechanisms and manage your diabetes better. Thank you for watching. Please like, comment, and subscribe if this was helpful. Stay healthy and let's beat diabetes.